Hi everyone, we'd like to continue today's video on the topic of late miscarriage causes. Now we've already mentioned that there's 4 distinct causes, and today we're talking about the second common cause, which is uterine malformation. Usually we talk about uterine malformations such as uterine septate, the most common one, and also very treatable if diagnosed properly. Others include naive uterus, unicornuate uterus, also known as a banana uterus, then uterine didelphys, uterine bicornuate. All of these conditions are where the uterus does not have a normal, healthy shape, and commonly they lead to early miscarriages. That's why early miscarriages are more common than late miscarriages. Late miscarriages are very rare, but if they do happen, uterine malformation can cause them. So during early pregnancy, because there is a very poor absorption of nutrients, very poor delivery of blood flow to the pregnancy, this is how an early miscarriage happens, because during the first 12 weeks, the fetus is actually developing its organs, nervous system, digestive system. It requires a lot of nutrients, a lot of blood vessels to actually help support it to grow and develop well into the second trimester, third trimester, which is why a pregnancy is most vulnerable during this period. However, it can also cause a late miscarriage during the second and third trimester. How this happens is because of the restriction of volume. Now, during the second trimester, the pregnancy is no longer an embryo anymore. It is now a fetus. This fetus has organs, has limbs, and is also exhibiting some movement. So it needs a lot of room and space to actually grow healthily. So for these types of uterus, if you have a uterine malformation and surprisingly you made it past this 12th week of pregnancy, there is still a risk that a late miscarriage can happen because of how little volume there is. Normally we would think that the uterus is very elastic. It should be able to expand many times in its volume, and that is correct, but that is for a normal and healthy shaped uterus, pear-shaped uterus with a healthy balance of tissues. For these types of uterine malformation, they have more connective tissues than there is muscle tissues. And this makes it slightly more rigid. It does not mean that it will 100% lead to a late miscarriage, but definitely increases the risk of it. So the uterine volume does not expand as much, causing the growing fetus to actually experience a lot of pressure. These types of miscarriages are known as pressure-induced late miscarriages. And because of how it is not expanding according to the pregnancy, then this will trigger a late miscarriage. So for these types of late miscarriage cause, there can only be preventive measure. You need proper diagnosis and treatment before pregnancy, because we cannot help you or do surgery on you after week 12 of pregnancy or even week 20 of pregnancy. It's very difficult to do surgery, especially during a late pregnancy. So diagnosis is very key. We will do a HSG, especially for trickier uterine malformations such as septate. Very difficult to diagnose. Naive uterus is also another one that is quite difficult to diagnose, but is very treatable if diagnosed properly. Unicornuate uterus is treated using a metroplasty technique, which means they will restore the shape. All of these uterine malformations, regardless of what it is, we want to restore the healthy shape and size of a uterus so it doesn't experience this nutrient poor delivery or even this not expanding according to the pregnancy. Antai Hospital offers a full contractual treatment for patients suffering from uterine malformations, and if you receive treatment with us, actually do a metroplasty to fix the shape, then it will not lead to any early or late miscarriage, and you can have a full-term pregnancy. Get in touch with us today.